So first of all, we are going to speak about history of endoscopy, what is endoscopy, types of endoscopy including rigid and flexible endoscopy, and how we are going to the endoscopy processing, care and maintenance, inspection, troubleshooting, and how to avoid repair. First of all, brief history of endoscopy. In early 19th, the first attempts to view inside the body with lighted telescopes was made. These initial devices were often fully rigid. In 1930, semi-flexible endoscopy called gastroscope was developed to view inside the stomach. Fiber optic endoscopy again in Michigan in 1957, and the widespread of fiber optic endoscopes began in 1960. So what is endoscopy? Endoscopy is a medical procedure that allows the doctor to view inside the body using an endoscope. It's a long, thin, flexible tube with a tiny camera and light at the end. The camera sends images to the screen, enabling the doctor to see internal organs and structures. So endoscope can be used to diagnose and treat various conditions, taking samples, biopsies, removing tumors, polyps, or stopping internal bleeding. That's flexible and surgical endoscope, the hard endoscope, or rigid. We are going to talk about flexible endoscopy. Digestive system, as we know, each part has a definite type of endoscopy to examine it. So, flexible endoscopy for the upper GI, lower GI, duodenoscope, enteroscope, capsule endoscopy, and finally endoscopic ultrasound. Gastroscope enables the physician to look inside the esophagus, stomach, duodenum, and the first part of the small intestine. For the procedure, you will swallow a thin, flexible, lighted tube called endoscope. Right before the procedure, the physician will give you a sedative. The endoscope transmits an image of the inside of the esophagus and the GI tract to carefully examine it. It takes about 10 minutes. Duodenoscope or ERCP combine the use of X-ray and the endoscope to examine the bile ducts. It can also detect and examine lesions in the esophagus, stomach, and the duodenum, but actually it was designed for the biliary tract. For the ERCP, it enables the physician to diagnose problems in the liver, gallbladder, bile ducts, and the pancreas. The liver is a large organ, among things, secreting bile. The gallbladder is a small pear-shaped organ that stores bile, and the bile ducts are tubes that carry bile from the liver to the gallbladder and small intestine. Here is the shape of the capsule endoscopy. Actually, capsule endoscopy was invented in 2001, was aiming at small bowel visualization for diagnosing small bowel disorders and causes of obscure GI bleeding. Process is simple. Just bowel preparation by standard colon prep, and then the sensor array applied and ingestion of the capsule, waiting for 6 to 8 hours, then downloading images. But it had only one problem, that it was only diagnostic. Then lower GI endoscopy, including colonoscopy and sigmoidoscopy, to examine the colon. It examines the entire large intestine from the lowest part, the rectum, all the way up the colon to the lower end of the small intestine, which is the ileum. It examines just to see inflamed tissue, abnormal grosses, ulcers, and bleeding. So colonoscopy takes about 30 to 60 seconds. Minutes. Sigmoidoscopy. It is not well used now. Okay, so we are going to skip this place. Endoscopic ultrasound is a minimally invasive, investigative, and therapeutic procedure which combines the principle of endoscopy and high-frequency ultrasound. Endoscopic ultrasounds done with an echo endoscope at like you see in the image, with a thin tube with camera and ultrasonic transducer, which is introduced into the gut to produce visual and ultrasonographic images on the screen. So Dr. Lubna talked about the design of the scope. Everyone should know the endoscopy system and how to deal with it. Endoscopy system contains a camera processor, monitor, light source, video recorder, video printer, suction system, and trolley with a hanger, endoscope, and endo accessories. This remarkable piece of endoscopy can be directed and moved around many bends in the gastrointestinal tract. So now they come in a pure fiber optic instrument, and this is not used anymore, but we have the video endoscopes. Tiny optically sensitive computer chip at the end. Electronic signals are then transmitted up to the scope to computers and displays an image on the large video screen. An open channel in these scopes allow the instruments to be passed through in order to tissue sample, remove polyps, and perform other exams. This is the fiber optic scope, and here is the video scope. So as you see, although it is very tiny actually when you look at it, but with time when you are working with the scope, you find that it's very heavy and actually, yes, causing trauma and causing multiple problems to the leaders exactly. Construction of the flexible endoscopy with the control body, insertion tube, light guide tube, sorry. The control body houses the following: angulation mechanism, air and water suction valves, eyepiece for the fiber optics, or remote function buttons for the video scopes. You see this small insertion tube is made of a complex plastic containing LG fibers, air and water channels, biopsy channel, angulation wires, and LG fibers or CCD. Another endoscopic processor suction. Light guide tube. It contains the following: LG fibers, air channel, water channel, suction, and control wires. This is the standard channel, air, water, and suction channels in each scope. So another image. That's like endoscopy accessories. You can use biopsy forceps, graspers, baskets, ejector, dilators, knives, and a lot of other accessories. How we are going processing of the scope: mechanical cleaning, disinfecting, and rinsing. Every physician, before working with patients, he should know the scope, how it works, how to use it, and how to deal with it, even the disinfection. So in the scope processing fluids, we use detergent, medical grade low foaming neutral pH, or enzymatic with proper dilution and temperature. Disinfectant like glutaraldehyde, mostly used and safe. Rinsing water, sterile water is needed to remove detergent and disinfectant residuals. All channels must be flushed properly. Then endoscope to be dried by wiping, and then hang it in a special endoscope cabin. Flexible care and maintenance. It must be inspected before and after use of the following: insertion tube should be inspected, LG tubes, bending mechanism, optical mechanism, general inspection for the appearance, endoscope to be leakage tested. And this is very important because actually you can find a lot of places, if there is any leakage in the scope, to go for the maintenance and to come back for you, it's going to take months and maybe years. So the leakage test. Endoscopes must be checked against any leak or damage before use and processing to ensure its efficiency and avoid an instrument malfunction during endoscopy. Leakage tester is an instrument which can be attached to the scope and blows air a certain pressure of air set by manufacturer inside it. Then endoscope is immersed in a water basin and checked against any leak. If any leak is seen, endoscope must be immediately transferred for repair and must not be used. Actually, if you use it and any leakage is there, the camera will be destroyed, and the camera is very expensive actually. So, flexible endoscopy troubleshooting. Why do air and water problems occur? The scope is not cleaned immediately following the procedure, so you must clean it. Nozzle is damaged, missing, or misaligned. Severe glutaraldehyde buildup from chemical disinfectant can break away from the channel and block the air-water nozzle. Okay. How do bending sheaths become damaged? Any sharp object, such as instruments, fingernails, or bites, can cause tears or holes in the sheath material. That's why we put a mouthpiece in the mouth of the patient. Over time, normal wear or overinflation can cause stretching or loosening of the bending rubber material. If the ETO cap is not placed during the ETO gas sterilization process, the scope will pressurize and bending sheath will explode like a balloon. How do fluids problem occur? If a scope has a leakage which is not detected, the scope comes in contact with any fluids, moisture will enter the scope through the leakage. The scope will have major fluid invasion if the scope is immersed in the ETO venting gap. For video scopes, the waterproof cap must be attached before contact with any fluids.
Sorry, Professor Eman, we are out of time.
Yeah, okay. 1 minute. So, how we avoid repair, and that's the most important. Proper handling of the scope, using recommended accessories correctly, proper processing and using protecting cover in case of video scopes, avoid harmful shaking, dropping, or hitting against any hard object, leakage test before and after use, storing in clean, dry, well ventilated, and maintained at normal temperature. Thank you.